we go.
Right.
Hey, what's going on, everyone? This is Drew from Incredible Marketing here at the IM3 booth, joined by Dr. Weinstein from New Jersey. Welcome. Thanks for joining us.
Hi, how you doing, Drew?
Good.
How's it hanging, man?
It's going great. So,
That's
you enjoying
good.
the show so far? Any sessions that you've enjoyed particularly?
You know, I'm a member of the society for 24 years.
Okay.
And this is the 50th anniversary, and I am like super excited about it.
Awesome.
Because, you know, one of the founding members of the society was my uncle, Joe Safian.
You're kidding me.
So it's like a really exciting thing to be here and see the expansion of the Aesthetic Society and, you know, the dedication of everybody to the science of aesthetic surgery, to the benefit of the population of people who request plastic surgery.
Sure.
I think that's the thing that society most exemplifies.
Sure.
The safety aspects.
Yeah. So how much? So you said 20 plus years you've been a member?
24 years.
How has this evolved? 24 years ago, what was it like to be an ASAPS member?
Well, it used to be like a smaller group, and we used to have smaller venues, and the venues have become larger,
Right.
more inclusive, more international in scope.
Yeah.
You know, it's
I have noticed at the show there's a lot more Brazilians. I've met some people from Lebanon. Sorry, I met someone from Russia as well today. So there's a lot more international.
Yeah, we like to share information, and we love people to come from other places who have experiences and share their experiences.
Right.
You know, because it's about sharing information and also learning what's best for our patients.
Sure. So would you say that for you attending these conferences, getting to meet with your colleagues and swap ideas, even international, that some people are doing things in Brazil different from here, is that one of the big benefits of why you come?
Well, part of it, but also I like to see the scientific analysis of new technologies. And also, you know, like, for example, I was in a new technologies luncheon on Friday. It was a 6-hour conference, you know, which was pretty intense to sit for 6 hours and listen to different people talk about things. But there was one specific thing that was very interesting to me. It's called paradoxical adipose hyperplasia.
Mm-hmm.
And
say that
it's a
3
new
times
diagnosis.
fast.
I can't say it 3 times. I'm barely able to say it once, you know. But the reality is, CoolSculpting, which is a new technology where you freeze fat,
Right.
Has a new problem, because certain patients paradoxically will increase the amount of adipose tissue, which they've seen in maybe 1 in 10,000 patients, but those patients require liposuction to remove the fat and, instead of the CoolSculpting. CoolSculpting works in some patients, I think 22% reduction in fat, but it's not like having liposuction. Liposuction, you go in and you take the fat out. I was part of the original study to determine the safety and efficacy of liposuction. I had one of the largest wings in the study, and we were able to show very few risks and complications from that. You know, is liposuction a surgery? Yes, but it's relatively safe procedure with minimal downtime and minimal side effects.
So do you offer both liposuction and CoolSculpting at your practice?
No, I don't. You know,
just liposuction?
I tried that CoolSculpting. It was painful, and it was painful for me for like 6 months afterwards. It didn't change my abdomen at all.
Yeah.
You know, it's nothing like doing Weight Watchers and exercise, but if you do have a diet-resistant area of fat, you know, why waste money on CoolSculpting when you go right to liposuction and have it fixed? And if it's a small area, we can do it in the office on the local.
Sure.
You know, the other thing is, you know, I was a violinist in the orchestra in high school, and finally that comes in handy because, you know, moving the bow back and forth when you play an instrument is exactly what we have to do for liposuction.
Right.
So understanding the vibrato of moving that cannula back and forth very gently has come in handy for me for lipo-sculpting. It's not even just liposuction, but it's really sculpting the body and making it look better.
Right,
That's the key.
Why did you get into plastic surgery?
I love transforming someone's body and making them appear more natural and better looking. I like to fix the problems that they have concerning an individual area. It's like I'm really, like this week, I was able to operate on the sister of a patient who had fixed her neck. I had done a facelift with SMAS for her sister, and I was able to completely fix the jowls and neckline. And I was honored that her sister came, and I had that.
Yeah.
I did that last week and completely fixed the neck and jowls. And the third sister's coming in next month.
There you go.
You know, so I think, you know, I'm very proud to be able to offer people quality procedures with quality results. I go to India once a year to do surgery for children.
Nice.
And I do cleft lip surgery and a lot of very significant problems.
Cool.
But I don't ever underplay the problems that people show me that they don't like. If someone is really upset about their jowls and their neck, it's probably should be addressed and fixed with appropriate procedure.
Great. Awesome. Cool. All right. Well, thanks for joining us, Doctor. I hope you have a good rest of your show.
Yeah.
Thank you.
All right.